Focusing on our February Woven Basket recipient. We are so lucky to have We Health Clinic joining us today. We Health Clinic is the area's only sexual, reproductive, gender-affirming, and abortion health care provider in the region. We Health Clinic's Executive Director, Paulina Briggs, and Operations Director, Jordan Wigfall, will discuss the clinic's 40 years of care, its current offering of services, and the challenges and success the clinic and greater reproductive freedom movement is facing in this time. Please give a warm UUCD welcome to the We Health Clinic, and thank you both so much for being here today.
Hi, everyone.
Hello.
Hello.
Hi, everyone. Thank you once again for having us. We're always so grateful for your continued support and for listening to us talk about our work. So happy Sunday, and hello to everyone online too. Is everyone familiar with We Health Clinic and its work, or anyone not heard of us before?
I'm new to the area, so.
Okay, yeah. Well, We Health Clinic, like they said, is the area's only sexual, reproductive, and gender-affirming and abortion clinic in Duluth. Our roots go back to all the way back to 1975, when the Midwest Health Center that was established as the first abortion clinic in Minnesota, and that was based in the Twin Cities. At that time, 98% of abortions were performed in the Twin Cities, even though 55% of patients were from greater Minnesota, rural Minnesota. So the leaders of that clinic recognized the need to increase access to abortion care throughout the state of Minnesota and identified Duluth as a really important site. So they established kind of a satellite clinic here in Duluth that was called Midwest Health Center Duluth. And Dr. Jane Hodgson was our first medical director. For those of you that don't know her, you should really look her up because she is definitely a Minnesota hero, a huge advocate for reproductive rights and abortion rights. She was very inspired by the number of people that she saw in her own practice coming to her hospital facing complications of illegal abortions. So she saw firsthand the effects of abortion access. She became the first doctor to be convicted of performing an abortion in a hospital in the US, so her conviction and her advocacy was really instrumental in legalization of abortion in the US. And she really saw the importance of moving abortions outside of the hospital setting to a clinic to a clinic location, because that can help increase access, reduce costs, reduce risks in the hospital. More safe and more straightforward in a clinical setting. But yeah, our clinic was established with Tina Welsh as our first executive director. So
It's Tina's birthday.
It's Tina's birthday. So she could probably tell you a little bit more about the history of the clinic better than I can, for sure. But the clinic became self-reliant and separated from the Twin Cities kind of parent clinic early on, and became the Women's Health Center in 1983. And the clinic in its early years did have to kind of bounce around in locations. First it was in the Medical Arts Building, and then it was in Arrowhead Place, and at both locations we were just renting, and we were facing a lot of backlash, anti-abortion, protester activity, and the landlords and other tenants of the buildings that we were in did not appreciate all that activity, so we were forced out a couple of times. And so
the building here now.
We do, yeah. So those evictions really prompted that and made us recognize the need for the clinic to have its own permanent home. And so Tina Welsh, along with the leaders of the YWCA Duluth and PAVSA, organized a huge capital campaign to raise the capital to purchase the building that we're in now and renovate it to make it purposely built to house an abortion clinic forever.
Yeah, that's not you. Let me try to figure this out.
The other one wasn't working.
Oh, it wasn't?
It
Yeah,
wasn't
that's
working the other day either.
I don't think this one's
It's not
working.
working that way.
Yeah, kind of. So yeah, we bought the building and renovated it and moved in 1993, and the building continues to serve as our permanent home, and it also houses the offices of the YWCA, PAVSA, and then there's also some community rooms available in the basement for rent for different organizations and people to use. The plaza outside is used for public events too, and the building continues to also rent out some pretty affordable office space to other local nonprofits too. So that's a little bit of history about the clinic. Now I'm going to talk to you about some of the legal work that the clinic has done around reproductive and abortion healthcare access. So Doe versus Gomez was a court case here in Minnesota where the Minnesota legislature was trying to restrict access to abortion by passing a statute that prohibited the use of medical assistance to pay for abortion. So medical assistance is the low-income insurance option in Minnesota. And the Supreme Court ended up ruling that our right to have and to decide to have an abortion is protected by the Minnesota Constitution. So that ruling determined that not only is abortion protected in our Constitution, but as a result of that, it has to be covered by our insurance. So Minnesota joins one of only 16 states in the US whose medical assistance state insurance program covers abortion care. So we're very lucky to live in Minnesota that recognizes that need for that coverage and that care. Another important legal case that the clinic was involved in was Dobbs versus Jackson, which happened in 2022. Or that actually, we were not involved in this, but that was the case that overturned Roe versus Wade. And of course, that had huge impact on abortion care throughout the United States. And us here in Minnesota have also definitely felt the ripple effects of that too. Minnesota is surrounded by states that either have restricted abortion access or are like kind of continually threatening to. And so especially when that law first passed, we saw a huge wave of patients traveling to Minnesota to access abortion care. And here in Duluth, we saw a little bit of that, but we also saw a lot of Twin Cities patients traveling to Duluth because out-of-state patients were going to the Twin Cities. And so it's just kind of this outward effect. So, yeah, we continue to see the effects of that. You know, the laws are constantly changing, and yeah. Another important law thing that happened was Doe versus Minnesota, which removed restrictions to abortion access in Minnesota in 2022. Some of the restrictions that we had in place were that we had needed to get parental notification for minors getting abortion care, but that's no longer required. Minors have the right to access sexual reproductive health care on their own and don't require parental notification or permission in Minnesota. It also allowed for like physician's assistants and nurse practitioners to practice abortion care, and a couple of other restrictions. So it just in general made abortion care more accessible in Minnesota. And so that kind of brings us to the clinic today. So in 2019, We Health Clinic, we changed our name to We Health Clinic from Women's Health Center, and that was done in an effort to better reflect the services and the variety of patients that we serve. We don't just serve women, we serve people, all people, and so we wanted our name to reflect that too. Jordan and I have both been in our positions as clinic directors for 3 years now, but we've worked at the clinic for almost 10 years.
Yes, this year will be 10 years.
10
this
years.
Year will be 10 years.
Yeah. And you know, the clinic has changed a lot in that time, and in our 3 years as director, it has too, and we've really kind of focused during our directorship on building out to kind of better manage the admin side of things. I'm sure Tina can talk about how challenging it is to not only run a nonprofit, but also a medical clinic. And so building up our admin team, we're also utilizing more mid-level practitioners like nurse practitioners and PAs just to better spend our funds and make medical care more accessible when compared to physician care. And we're transitioning to an electronic medical record. That's a big move for us from paper churning for 40 years. We are expanding some of our services too. We're always trying to make our services very progressive and patient-centered. And so we now offer medication abortion up to 14 weeks of pregnancy throughout the United States. The standard is usually 10 or 11 weeks. I don't exactly know why that is. I think but in other parts of the world, medication abortion is used much further into pregnancy and is shown to be safe and effective. So we decided to follow the medical evidence and make it the gestational age limit for medication abortion higher, just to, again, increase access. We also offer advanced provision of medication abortion, and that means that we give out all the supplies, all the medications for medication abortion ahead of time, before someone's even pregnant, so that they're able to have it on hand in case of a future pregnancy. That is also very kind of cutting edge care in the United States. You know, these medications are shown to be very safe, shown to be very effective, and as long as we educate patients on how to use them when they need them, it's our opinion that, you know, kind of the more of the accessible this medication is, the better. And so we're one of only, I believe, 4 clinics in the US that's offering that advanced provision of medication. So we're really proud of that offering too. And then also our gender-affirming care program has been in place now for about 5 years. 5 years, right?
It's been since about 2020.
2020.
Yeah, so maybe about 5 years.
5, 6 years. So we're also very proud to be one of the few providers in the area offering gender-affirming care. Currently, we only offer that to people 18 plus, but we're looking into expanding into youth care too. And yeah, so.
Yeah. All right. So, so with our service numbers for, so like Paulina said, we offer abortion care up to 17 weeks. We do 17 weeks for suction abortion, in-person medication abortion up to 14 weeks, and then telehealth medication abortion up to 12 weeks. We have doctors and nurse practitioners that work at our clinic. We have added 2 new providers in 2025 because our medical director retired, Jake Johnson, and then we brought on a new medical director, Ruth Lemon Beans, and she has been doing a great job with you know, staying up to date with everything that we need her to and things like that. So some of our services that we offer are wellness exams and pap smears. We offer gender-affirming care, STI testing and treatment, with including rapid HIV and syphilis testing, vaginitis, UTI testing and treatment. We offer PrEP and contraceptives, including IUDs and implants, emergency contraceptive, ultrasounds, pregnancy tests, miscarriage management, follow-up support for patients who may have had an abortion at another clinic, but then let's say they did like a virtual appointment and that clinic doesn't actually have like a facility for them to actually have a follow-up at. They can call us and we are able to, you know, like get records or figure out, you know, like how we can help them. We offer telehealth services for multiple different services that we have. And then, like Paulina said, we offer advanced provision. And then we do some MNsure navigating still. Paulina is actually pretty popular in the area right now for Spanish-speaking patients that need to get on MNsure, get insurance. So she's been helping many patients be able to get on insurance that are speaking Spanish. That's been amazing at our clinic. For our numbers in 2025, we did 488 abortions this past year. We had 152 suctions, 178 medications in person, and then 153 telehealth medications. And then for advanced provision, we gave out 17 advanced provisions to non-abortion patients, and then 118 out to abortion patients. And our numbers are actually down from the previous year, and part of it is that we think that it's become a little bit more accessible for patients to be able to get to medication abortion. And then also because we have given out so much in advanced provision, we've only had 5 patients that actually called us and told us that they took their advanced provision, but we suspect that there probably is more patients that actually, you know, use their advanced provision that we gave them. So for family planning services patients that we had this year, we had 880. For gender-affirming care patients, we had 84. For STI tests, we had 1,031. For EC dispense, so emergency contraceptive dispense, we had 907. For any kind of LARCs, like implants, IUDs, things like that, we had 85. And then for total patient visits, we had 1,673. So that would have been the amount of different services that we offered to patients. So yeah, we had a lot of things that happened. We had, you know, good numbers this year of, you know, like having patients come in and things like that. And then some of our anti-activities, so that would be like all the protesters that stand outside of our clinic that don't believe in what we're doing. Versus the persistent anti-abortion presents outside our clinic each week. Groups are about 3 to 15 people. We have a volunteer escort program who helps people pass the protesters into the building, keep an eye on them for us. We have our own 40 active clinic escorts and 15 to 20 cover any average clinic shift. Anti-abortion groups continue the same intimidating tactics at our clinic, such as putting their bodies between escorts and patients, trying to get into patients' vehicles, following patients more than a block down the street on foot, lying to patients about what they can and can't do inside of our clinic. An example would be they tell them that they can't view their ultrasound, that they can't look at their pregnancy tissue, that they can't leave at any point, which is an absolute lie. If a patient comes in and wants to change their mind from a medication to a suction, we are able to do that on the day. If they, decide that they want to view pregnancy tissue and then change their mind later and is like, nope, I don't want to anymore. That's absolutely their choice. No one is kept at our clinic for any amount of time if they don't want to be there. Anybody is able to leave at any point. Taking pictures and videos of patients, aggressively targeting patient companions, encouraging them to go into the clinic and get the patient or save that baby is what they constantly tell everyone. Targeting clinic escorts in their personal lives and harassing them at clinic by referencing knowledge of their personal lives, especially if they are faith leaders or recognized for social justice network or justice work. For crisis pregnancy centers, we do have one kitty corner from us. It's called the Women's Care Center. That's the crisis pregnancy center that is near us. They tell patients lies about our clinic, such as saying that patients need to have an appointment with them before they are able to be seen at our clinic. It's a huge misconception of patients, and we have patients that call even that had never talked to a CPC that are like, do I have to come in and have an ultrasound before I able to have an appointment? And we're like, nope, we can set up an appointment with you. Or they call and they are asking, I want to know about my options. And we go through their options, and sometimes they think that they have to do that before they are able to make an appointment. And most of the time we just are kind of like, what options are you wanting to know about? Are you wanting to know about childbirth and adoption and abortion, or are you wanting to know about your options for abortion, like telehealth, medication, or in-person suction? And usually they just want to know about their options of which abortion they'd like to have. So that's usually pretty nice. They will give patients false information about their ultrasound, so they may tell the patient that they are further or not as far as they actually are, and then that can be detrimental to patients when they come to our clinic and they are actually over the gestational age that we can go up to, or if they lied to the patient and said that they were 15 weeks and they're only 6 weeks. And they come to us and they're in panic and we're like, oh, you're much earlier than you thought you were, and usually that is very relieving for patients, but not telling patients their pregnancy options, and there are 93 CPCs in Minnesota compared to the 8 abortion clinics. So that's pretty large number that we are up against.
So at We Health Clinic, we accept medical insurance, including medical assistance. Nearly half of our patients at We Health Clinic use medical assistance. And then, most private health insurance doesn't cover the cost of abortion care. And so for those patients, we do have an in-house clinic abortion fund. It's called Hot Dish Militia. And those funds are help people directly pay for their abortion care. And we're very excited because of an outpouring of support. Hot Dish Militia is expanding from just being an in-house clinic abortion fund to an external clinic abortion fund. And so what that means now is, there are several abortion clinics throughout the state of Minnesota. And so now any patients from the Midwest traveling to one of those clinics, we are going to offer them funding assistance to help pay for their abortion care. So
We have been able to.
Yeah. There we go.
So, we've been able to use the huge amount of support that Hot Dish has received recently to make abortion care accessible, not just here in Duluth, but throughout the state of Minnesota, which we're really excited about. We Health Clinic is interesting because being a nonprofit, we receive revenue operationally through the services that we provide through, insurance reimbursement, patients paying out of pocket, working with other abortion funds throughout the region to help cover the cost of patients' services. we also, heavily rely on grants from both private and state funds, as well as donations from organizations and individuals like yourselves. So we're so appreciative of your support and making our work possible, because there are financial challenges to being a nonprofit abortion clinic in the U.S. right now. And some of those financial challenges include, again, private insurance not covering abortion, so having to support patients with that. Even when insurance does cover abortion care, that is good for patients. However, the actual reimbursement rate that we see as a clinic is incredibly low. For example, like I said, with medical assistance, nearly half of our patients use medical assistance. And the cost of providing an abortion is $750. However, the reimbursement that we receive from the state for that service is $240. So we operate at a net loss, a pretty significant net loss, for nearly half of our patients. And so we've been doing a lot of advocacy work with the state to try to increase those reimbursement rates because they haven't been updated for over 15 years. And other states have been increasing their rates, so there's no reason why we can't, and especially if Minnesota is claiming to be a island of access, an important space for abortion access in the U.S., for us not to be reimbursed appropriately really doesn't line up with that goal of trying to increase abortion access in the Midwest. Similarly, with our telehealth medication abortion, we're really proud to offer that and make abortion more accessible throughout the state using technology and virtual visits. However, once again, the cost of that is $400, and the reimbursement that we see for medical assistance from that is $60, which is not even enough to cover the cost of the medications themselves, let alone any staff time or overhead. So that continues to be a financial challenge, and I think that is why we are so appreciative of the community's support. And despite those challenges and despite the reimbursement rate being low, we have decided as an organization never to cap the number of medical assistance patients we see, because we recognize that those lower income patients are in need of these services just as much as anyone else, and so we do not cap the number of MA patients that we see, which is an option which some medical offices choose to do. We also, provide other forms of charity care, so nobody has to be turned away due to an inability to pay. We have different funding sources for all of our patients now, and so we're really proud to make care as accessible as possible for as many people as we can. So now we can open it up to any questions that anyone might have.
I am working on this mic, so two things. It is February for our woven basket, so I am going to pass around this for everyone also. If you do have money to give, we'll be doing the same thing in the service. But as Paulina and Jordan mentioned, definitely do that. And then, are you okay, since I'm still trying to juggle this testing? Yeah. Can I go back and forth? Is that all right? All right. And a reminder.
Yeah, we can help.
All right, thank you. And a reminder for anyone online. To feel free to also put in the chat if you have questions. All right. We'll start here.
I'm just shocked to start working on
What's try again for the Zoomers.
the anti-abortion. Still
This is hilarious. This keeps going back and forth. All right. You're doing great, thank you.
In my 20s and 30s in California, and they covered everybody. I went to Planned Parenthood for my yearly exams. They were so good, the doctors and the medical people. And is the White House kind of funding to Planned Parenthood and therefore you clinics like you guys? And how is that legal? I mean, we need to have women get care. Period. It's just, I'm shocked. So if you could speak to that.
Yeah, there's several bills that prohibit federal funding from being used on abortion care. And so the MA coverage that we are privileged to have here in Minnesota is all state funded. So it is very state by state dependent on what coverage is in the United States, and that's an unfortunate reality, but we are lucky in many ways to be in Minnesota. But there does continue to be one of the big things that happened this year was all of those funding threats, specifically targeted towards Planned Parenthood. That was part of the spending bill that they just kind of snuck in there that essentially attempts to defund Planned Parenthood. And that caused a lot of chaos, and it's still kind of unclear where things stand with that. You know, there was legal challenges, appeals, things processing. Certain states were suing, other states weren't. And for a period of time, Planned Parenthood wasn't accepting new medical assistance patients. Here in Minnesota, I know for sure. And so it just causes, the whole purpose of it is to cause chaos and uncertainty. And that's exactly what it did, because we had many patients who were told by Planned Parenthood that they would no longer accept their insurance and they couldn't provide them with care. And so they were coming to us. And so that definitely continues to be something that we are planning for and doing kind of crisis response planning for, because it still very much is possible that Planned Parenthood could lose significant parts of its funding. I know that they've already closed some clinics down throughout the United States because of these funding challenges that they're having. And it's independent clinics like ours that would still be standing and still doing our best to try to, make up the difference. But it's pretty challenging right now, a lot of uncertainty.
Medicaid cuts in the big bad bill, how do you anticipate that might impact your clinic?
Well, for our abortion services, like I said, medical assistance coverage for abortion is state funded. So, as long as our local leadership continues to be supportive, our hope is that won't be affected. However, for all of our other services, we're most known for being an abortion clinic. However, for the other 5 days of the week, we're a sexual reproductive health care clinic. And Medicaid cuts for all of those services would certainly impact our bottom line too. Like I said, nearly half of our patients are low-income patients utilizing medical assistance across all of our services. So Medicaid cuts would be a big deal. That being said, though, the clinic, the clinic is in a really good financial position right now. Ever since the Dobbs versus Jackson decision, the overturning of Roe versus Wade, we really saw a huge wave of support from both local donors and then also national funders of abortion and reproductive health care rights throughout the United States. And so that support has really put the clinic in a spot where we are able to expand our abortion clinic fund. We're able to expand our services. We're able to, we've been able to put ourselves into a financial spot, and we have enough of a safety net where these uncertainties aren't, the end of the line for us. We have enough of a nest egg to get us through really tough times. Hopefully, in 3 years, things might change for us politically. So, while there is uncertainty, there is also a lot of support out there that we've seen after the overturning of Roe versus Wade, and what that we've continued to see in all of these challenges.
We also have multiple different funding options at the clinic for patients. Like we have a patient fund, so if somebody comes to us and they don't have insurance or they're in between insurance, we are able to still get them services. We also have a pretty much low out-of-pocket if somebody just wanted to come and pay out of pocket for services. Because we get medication through 340B, which is a discounted program through federal, which is federal, that we help out patients with that as well if they needed to pay out of pocket. If you're going to go to Essential Health and get an IUD placed, you're going to pay $1,500 to $2,000, and at our clinic you're going to pay under $500. And that's out of pocket. That's for the device. That's for the insertion. That's for the office visit. You're going to pay a significant amount less at our clinic because we really believe that it is important for patients to have these kind of services and to be able to, have the body autonomy that they need to have.
All right, we got Will and then an online question from Eric.
Would you mind discussing the relationship you have with Planned Parenthood? Is there an interrelationship? Do they have duplicate services?
Yeah, so We Health Clinic has been in Duluth for over 40 years, and I believe Planned Parenthood has been in the area for around 20 years. The Duluth Planned Parenthood does not offer abortion services. My understanding is that that was kind of a mutual understanding that our clinic and them came to, so as not to dip into our patient population, our patient pool. So they've continued to honor that, and they don't offer abortion services at their Duluth location. There is some overlap in services. You know, they're also a sexual and reproductive health provider too. So yeah, there are some overlaps in services. They also provide gender-affirming care at their Duluth location as well. And our relationship is pretty good. The clinic manager of Planned Parenthood actually used to work at our clinic. So locally, our relationship with the Duluth Planned Parenthood is very good. And on the national level, I mean, Planned Parenthood is incredibly important. They're the most recognizable and well-known abortion provider in the U.S., and they do a lot of legal advocacy for abortion rights. The thing about Planned Parenthood is that they are a huge, organization, and they come along with the, kind of challenges that might come along with that. I mean, like I said, our relationship with the local Planned Parenthood is very good. But I think what kind of gets missed in a lot of these conversations is that independent abortion providers like We Health Clinic actually provide the majority of abortions in the U.S. It's not Planned Parenthood, it's local abortion clinics like ours. And local abortion clinics like ours also tend to go higher in gestational age than Planned Parenthood's. And we tend to stick around in states that are having their abortion laws challenged. Planned Parenthood is kind of very risk averse a lot of the times, and so they tend to kind of leave a state, and independent providers have been kind of the leaders in challenging some of these bans and restrictions that are happening in states. We like Planned Parenthood, but as a small independent clinic that's able to really provide care landscape of abortion access, sometimes it feels like we're just so nimble in that way, and Planned Parenthood sometimes kind of like lagging behind, and so we get a little bit frustrated with them. And once again, them being like a huge organization sometimes comes with its own challenges, because we've had instances where patients call Planned Parenthood saying, I'm in Duluth, I want to have an abortion. And they send them to their Planned Parenthood location in the Twin Cities rather than telling them that there's an abortion provider right in their own town. We like Planned Parenthood, but also they're a huge organization that has their own challenges.
You're great. I do have a question online here, Kathy, and then I'll pass it to you next. This one is, it is appalling the level of intimidation and threat that employees undergo to assist patients at the clinic. How do employees protect themselves and keep from being worn down?
Well, I think
Jordan wants to answer that. I can see she's on it.
We do regular check-ins with our staff to make sure that they are comfortable with working at the clinic. If there's any security things that they are concerned about, we address those pretty quickly. And especially with, just want to speak to this, especially with, ICE being in Minnesota and, in the Duluth area. We have taken, multiple precautions for patients and for staff to make sure that everybody is safe, that, nobody's going to their cars by themselves, that, everybody kind of sticks together and does what we can. We do a lot of check-in with our staff to make sure that they are comfortable, and when things happen, we try to make sure that we're on top of it as much as we possibly can.
Yeah, also, I think the work also attracts people that really know what they're getting into. You don't just start working in an abortion clinic without knowing that there's going to be, some friction against that. And it just means that people that come to work with us are really passionate and really kind of badass. And I don't know, I think we all know where it is that we work and what it is that we face on our way in the door. But it's surprising how quickly you get used to it and how quickly you can also drown them out. And we have a staff parking lot, so we don't have to walk directly by the protesters every day, which also helps. But they are pretty loud and noxious and annoying.
Okay, here's a question. The FACE Act, which is the what that stands for is the Freedom of Access to Clinic Entrances Act, was passed in 1994. Was recently used apparently to arrest Don Lemon, who was reporting in a church in the Twin Cities. Explain to us a little bit how that happened.
My understanding of the FACE Act is that it was initially, this is a federal act that their intent was to protect access to hospitals, clinics, people accessing medical care. And it was pretty specific to abortion providers because at that time, protesters were preventing patients from entering medical facilities for abortion care. I believe that they also, when they passed this law though, one of the concessions that they made, and something that the other side kind of snuck in, was that not only is this going to protect people accessing care at a medical clinic, but it's also going to protect people from, during religious gatherings, from their ability to gather religiously from being impeded by outsiders too. So they kind of combine the two issues together in kind of a weird way. But yeah, and then historically the FACE Act has provided a lot of protections for abortion clinics when there are favorable administrations that are actually enforcing the FACE Act. The current administration is not doing so, and we've actually felt a very real repercussion of that in our clinic. We have recently had a new to us protester outside of our clinic that we have identified as a nationally known clinic invader. So he's known to go into clinics and like handcuff himself and arrested and charged under the FACE Act. But then when the new administration came in, they stopped enforcing that and released him. And so now he's been hanging around in our area. So we definitely felt the changes to the FACE Act recently.
Thank you.
I have one if nobody else does, and I guess that is just how else beyond financially supporting you can we be involved? Are there events? Are there other opportunities for volunteering? You name it.
Yeah, the clinic itself has one big fundraiser every year. It was previously held in here, which was very lovely for a number of years, but we have outgrown this space, which is always good news too. So now it's at the depot. It's in March.
Try this.
It's in March, and it's a gala dinner. It's a very nice time. I encourage you all to come then. And then Hot Dish, our abortion fund, also has two really fun fundraisers every year. There's a bowl-a-thon where we go bowling and fundraise. And then there's a Hot Dish bake-off competition, which is also very fun. The whole community bakes hot dishes and we judge them. So that's also very fun. And then we do have volunteer opportunities, the escorts that help patients in past the protesters every week. We do pretty regular trainings for that, and we appreciate people doing that. And then we also, that's kind of a lot of work, and it is it's not for everyone. So we also have another volunteer group. We call it our I forget what we call it. But
it's like our long-term volunteer.
Our long-term volunteer group, where we put out calls for like monthly projects that we're working on. We might need volunteers. And then we also have merch, so you can buy We Health Clinic merch on our bonfire store, and a portion of the proceeds go to our clinic. We also have an Amazon wish list, so if you want to buy supplies for the clinic, you can look on our website for that too. And then, I think another big thing too is also just telling people about us. The clinic in the last, especially 10 years or so, I would say, has really tried to be more outward facing and more in the community. For a long time. I think we were a little bit more inward facing, which is very understandable, given some of the response that we've gotten in the past. However, things have changed, and Duluth has been very supportive of us, and so we're really trying to put ourselves out there and get more people to know about us. So telling people that they can be patients and receive services with us, or liking our stuff on Facebook and sharing our information, and just letting people know that we're around is also very helpful too.
Sally wants to volunteer for the bowl-a-thon.
I think our church should have a team for the bowl-a-thon. When is it? It just was, right? What is it?
No, it will be, what is it? I believe it's in April.
Yeah, it's like in April.
Oh,
Yeah, make a bowling team.
Yes.
Yeah.
We should do
Yeah,
that.
join like our newsletter, follow us on Facebook to stay up to date on what we're doing and what our needs are and
Yeah, we
fundraisers
will.
that we're doing.
We post everything on our social media. Like if anything that's going on, you're part of the email list. We send out emails about fundraisers.
Use the microphone for the
Sorry.
Zoom people.
Sorry.
Other
Yeah.
people on there? I don't know.
So yeah, sharing our like things on Facebook or in our social media. We also send out like emails about all our events and things like that. Like we're at Pride every year. We're at different tabling events. You can always come by and see us. So that's always fun.
I think we are close to time, so let us, I don't see any other hands, and so let us just transition. I know that both Paulina and Jordan are free to connect after this one-on-one. Next week is our quarterly board update, so we'll hear both from our treasurer as well as our board report. We'd love to have you back here. But before anything else, just a huge round of applause and appreciation for all that you both do.